Our centering program at UCSF is a group-based prenatal care model. It offers 10 to 12 women an opportunity to discuss their pregnancy, to get their routine prenatal care, but also to have very in-depth group education around pregnancy-related topics like breastfeeding, pain management, and labor.
Before centering, the kind of care that patients got were excellent traditional care. You came in, you saw your provider, you spent probably maximum 15 minutes with your provider, and then when you left. This is more like one-stop shopping. You get your education, you get your clinical care, and on top of that, you get friendship and community.
I am 32 weeks pregnant with my first baby. I didn't know what to expect. What interested me most about the centering program was that there would be moms who had babies already, who were first-time moms like me. Having those resources really appealed to me. I definitely was apprehensive about it because I felt maybe my issues won't be taken care of as they would be if I were to go one-on-one.
Even though centering is a group-based model, every woman has a moment where they are by themselves with their provider, so there's still the opportunity for individual care.
At first, I wasn't prepared. How do you be a parent? And there's no guide. But I came here and a lot of people were going through the same thing as me.
This was my first pregnancy. At the time, I was really intimidated because I was so young. I just wanted to have a support system because I was afraid to tell my family. At first, I really kind of doubted it a little bit because just the fear of really being judged.
Centering helps decrease stress around pregnancy. And that stress is probably the source of not understanding what's going on with your body when you're pregnant, not understanding what's going to happen.
The centering program helps with those fears because we actually have time to spend with the patients.
Centering group is a 2-hour session. And so that allows for greater conversation and exploration of topics of concern. Each centering group typically starts with women checking their blood pressure and their weight.
Patients do it themselves, and they actually put it in their own chart. That immediately sets up a sense of empowerment. Someone is not doing it for you, you're doing it for yourself.
And then after that, we normally have some sort of warm-up exercise which introduces the topic of the day. And then normally there's break time, and then there's another sort of activity that occurs usually in the second half, and then a closing exercise, often where people talk about their hopes and goals for the coming weeks.
That was the best part of my pregnancy, to come here and to learn about my baby before my baby came. Coming here changed my perspective and eased all of my fears.
It's a way for them to feel comfortable and safe, to feel vulnerable, and to know that no one is judging them. This is where we empower you.
Everybody was really down to earth. You don't have to have that fear of being judged. The program really just gave me strength and support and gave me hope that, okay, everything's gonna be okay.
And knowing that you have that support system somewhere else is something that has been invaluable. They have alleviated a ton of anxiety for me. That was something that I struggled with. We've kind of built a little network. We email things to each other. I would definitely recommend it.
The importance of centering is education and feeling and developing confidence that not only can you go through this pregnancy and birth, but also be a parent. And that's what centering really, really helps our patients with.
I would love for centering to be our default model of prenatal care. I think it's an incredible opportunity that many women just aren't familiar with, and so I would hope that almost all patients participate in centering.